Healthcare infrastructure in Nigeria is still underdeveloped and lacks modern medical facilities. As the country healthcare indicators are some of the worst in Africa. It has one of the fastest growing populations globally with 5.5 live births per woman and a population growth rate of 3.2% annually. More facilities need to be encouraged, especially in the private sector, as private sector is the key to cater for the rural community. This borne out the need for Zachary Bill to provide healthcare humanitarian service to support health system in remote community like Dakwa, a community under Buhari Area Council of the Federal Capital Territory in Abuja. The quality of the care linked to the end of the delivery of drugs, equipment, and human resources. This has helped to find solution to the chronic vulnerability.
But what actually inspired me is what has been so good to me in my life. I look around, I say, God, you have been helping me. What do I do? So that is the reason why I established this hospital. People come here, indigent people come here, we treat them. Sometimes they go on credit, they don't come back, but still it doesn't matter. It doesn't matter. The fact is that I always want, when people come in here crying, I want them to go out with a smile on their face.
The vision of the hospital actually, when it was established, is actually to cater for the environment, because for some time in Dakwa there have been no hospital to cater for the needs of people and they have to go far and wide. And the hospital was actually created to make sure it take care of such people that are around here that cannot go far.
The establishment was born out of its philanthropic reasons to ensure that the people in this setting have access to quality and affordable quality service delivery. Because if you look at the environment, it's more of a rural settlement, and you can hardly see such a facility, a hospital, around this place or in many rural communities. So, and the vision is to ensure that the rural settlements have access to quality and affordable health care services.
Vibrant health sector that began at the community with sanitary inspectors who were feared and charged with ensuring community safe practice and a horizontal linkage with the local dispensary, local maternity, and so on. This is linked to the area general hospital, which often ran alongside the health center. The local populace had a strong referral system that led all complicated cases to the center, even though these were few.
You see, as you are going out, before you come in, there are pictures of four quadruplet. That lady went to teaching hospital Babalada. They don't even have something to eat. They have 4 children, or 6, and this one is coming. They wanted to abort it. One of the ladies offered to buy. So why they used to go for scanning is belongs to one of those that helped me establish this place. So he called me. I said, look, this is what I have at hand. What can you do? I said, okay, discuss with my CMD. Whatever my CMD say, we are going to do it. The pregnancy was about 5 months now. So we took over their feeding because they cannot even pay their 2,000 naira rent, not to talk of feeding. So they came here working on the woman. We got some NGOs, we got other people, we sensitized the public. So from that 5 months, we were able to get them up to 8 months. And we did everything pro bono, free of charge. Not only that, when they were delivered through CS, we got NGOs, we got good philanthropists. Muslim from one, they came to our aid, they bought so many things, they contributed money. Where they are staying, they couldn't pay. I got in touch with some people like Femi Otodela, came in, donated 2 million naira, and as I'm talking to you today, they are in their own personal house, which we bought for them.
As healthcare manpower expanded and the hospital increased in number around the community, the clear lines between primary healthcare and secondary facilities and tertiary care have become blunted, with the results that the Federal Medical Center and Teaching Hospital often find themselves treating many straightforward problems.
Even we are in the private sector, we are finding it very difficult. First, to start with, is this brain drain about doctors. I have 3 medical doctors now. I keep this hospital and make sure that it is covered 24 hours. But we have a lot of problem now. Apart from the medical doctors, lights is our problem. When there's a delivery and the child is premature, you can see that we have what do you call it? Incubators. We have about 4 or 3 there. We cannot run these incubators without light. And you have a child there. You have to put one in a generator. That is one of our greatest problems in the health something. You transfer a patient to so they will tell you no, you cannot receive because our facility is already filled up. And when you call a doctor from outside, specialist from outside, come and handle, they charge us exorbitantly. It's either you do it, but if the parents or the relations cannot do, what do? You cannot throw away the patient. We have to manage the patient, sometimes at my own cost.
The way forward when it comes to medicine, let's be sincere ourselves, is private practice. I think more facilities must be encouraged legally, or how will I put it, rightly, to actually cater for more of the people. A teaching hospital that is located 100 kilometers away from a settlement actually is difficult. It's only the people that are actually in need of going to a teaching hospital that should go to a teaching hospital. I think the government should base their attention more on primary health care. But the way we are structured, unless if the government should do better, most doctors, most nurses will want to go to the city centers, and the primary health care are now manned by people that are not so qualified. So permit me to say that private setting, where you can have doctor, nurses getting satisfaction, so also patient getting their own satisfaction, because it's more of an entrepreneurship. An entrepreneur generally, just like we know, the facility will be catered for by the private owner better. What belongs to nobody belongs to everybody. But if this one is my own, I think I will treat it better and the patient gets satisfaction.
Despite the valiant effort made by a few private health institutions, the ordinary citizens is unlikely to feel their impact because the bills they get are at market rate and the public hospitals, which might be cheaper, are lacking in manpower and equipment.
It's not about establishing hospitals. You understand?
Yes.
Because you establish hospitals, you buy all the equipment and put there. And then you don't have the personnel, motivated personnel to operate. It's a setback. If you look at the history of this Abuja National Hospital, it was set up by Her Excellency, former First Lady Mariam Babangida, as women and children's, not government that built that hospital. When government came in after, they took over the hospital and maybe expanded it. The teaching hospital in Gwagwadada, well, that was a teaching hospital, it was established with the university. You understand? But apart from that, what other hospital does the government have? In some countries, government will encourage private sector to establish hospitals.
And it is a part of a system that you cannot run alone. So I think one of the biggest challenges I've been seeing all these days is the issue of industrial action. Yes, they are disrupted. I never thought that I, as a doctor, would be going on strike for myself when I've actually agreed that it's a humanitarian job. But in Nigeria, it becomes impossible to do without those things. I don't know how the circle will be broken, because it's a vicious cycle that has been going on over the years. But I think that's the greatest challenge to the medical field. Misunderstanding between even funding. I think that more money should be allotted to health. I think you've seen for yourself, the facility, so far so good, actually is well equipped. The facility has all that you need to take care of patients, both old and young, child, women, and deliveries, all of sorts. And the laboratories are actually also equipped with the state-of-the-art facility. We have machines, X-ray, scans, all sorts of scans. I wouldn't say we have a CT scan per se, but we have all that is needed to make at least a very good diagnosis to manage the patient. Our facility so far so good, actually can cater for at least a teeming population of Dakwa, 500 for instance. people, at least comfortably. Our pharmacy is also good enough with very, very branded drugs. And so far so good, we've not had complications yet. The complication that we've had so far so good has been taken care of. We have specialists that can actually attend to such people. I can say with all due respect, our facilities actually doing its best to the people of Dakwa.
The main goal of the humanitarian aid is to save lives and reduce suffering. However, humanitarian aid role in the community restoration also matters. If assistance only focuses on the short-term issues, it leaves community in the lurch for more challenging long-term concern.
We that we are in the private sector, we are finding it very difficult. First to start with is this brain drain about doctors. I have 3 medical doctors now. I keep this hospital, I make sure that it is covered 24 hours. Most of the drugs that you have now is generic. And before you get a branded, you have to pass through your nose. And now that GlaxoSmithKline has pulled out of Nigeria, we are going to find it more difficult because they are the major suppliers of drugs in Nigeria. A lot of fake drugs are around. So if a patient comes and you give him, you administer the drugs that have not met the standard. Let's just take, for example, case of malaria. He will go home after 3 days, or he will take injection after 3 days. And the ailment will continue. And what happens? Don't go to that hospital. They don't know how to treat people. Man can do. It's not about establishing hospitals. You understand?
Yes, sir.
Because you establish hospital, you buy all the equipment and put there. And then you don't have the personnel, motivated personnel to operate. It's a setback.
So in terms of, okay, she has covered the area of this environment. You also do outpatients, just people within the
Yes.
Dakwa axis.
No, that was
where
it.
and where you cover.
Which covers people come from Zuba, Kubwa, Mandala, Suleja. Yes. In fact, we receive patients from as far as Gwagwalada. Yes, Gwagwalada, Zuba and the rest. But chunk of our patients come from here. Mandela, Suleja and Dakwa.